Sunshine, it's our sunshine.
Hi, I'm Dr. Adarsh Annapareddy. I am an orthopedic surgeon and a joint replacement surgeon at Sunshine Hospitals. On the occasion of World Arthritis Day, which is on the 12th of October, I just wanted to educate you all about the meaning of the word arthritis. Arthro means joint. So an itis means inflammation. So basically the inflammation of a joint is known as arthritis. This can happen in any of the joints in the fingers or in the toes. But most commonly what we see in the OP is arthritis of the knee joint. And second most common is the hip joint. The most common type of arthritis, there are again different types of arthritis. So one is osteoarthritis, which is the most common type. This is not a disease per se, it is an age-related problem which happens to everybody at different periods in their life. What happens there basically is, now if this is a knee joint, I'm going to take an example of a knee osteoarthritis. If this is the knee joint, this is the femur bone or the thigh bone, this is the leg bone. And if you see this smooth tissue in between the two, this is known as a cartilage. This acts as a shock absorber between the two bones. So when the person walks, he has a nice smooth movement between the bones because of that cartilage. Osteoarthritis means the wearing away of this cartilage with age, like due to wear and tear. Like the tires of a car, they wear out after driving for over many months to years. The same thing happens in the knee joint. Now if you see this model over here, this is a normal knee joint where you have the normal cartilage in between. If you see this bluish smooth area, after it wears out completely, this is what it looks like, and the bone surfaces become raw and bare, and then they start rubbing each other, causing pain. This is called as osteoarthritis. The hip joint can also have osteoarthritis, and this is the normal ball of a hip, the femoral head. If you see again, you have this nice smooth blue colored thing known as the cartilage. As this starts to wear out, if you see this model over here, this is a worn out cartilage on the ball, and the cup also starts to get worn out like this. This is a moderate stage, and if you see a severe stage, this is what it looks like, completely worn away, and you have the cup also gets completely worn out. So these are all different types of arthritis, osteoarthritis in the knee joint and the hip joint. What is the treatment of this kind of an arthritis? It depends on the stage. Now, osteoarthritis is of 4 stages. In the first stage, the gap between the two bones in the knee reduces a little bit. In the second stage, it reduces a little bit more. By the time you come to the 4th stage, there's no gap left between the two bones. That is this stage over here. In that situation, we have to go for a surgical intervention. Up until the 3rd stage, exercises and medicines are enough. But once you come to the 4th stage, a knee replacement surgery is required. Like this. See what we have done over here. We've replaced the worn out bone above and below, and we've replaced it with metal and metal on the bottom and plastic in between, which again reforms our knee joint and the knee space. That reduces the pain. The same thing is for the hip joint. Once the hip joint wears out completely, we replace the ball as well as the cup, and we get a smooth movement once again. What are the other types of arthritis? I spoke to you about osteoarthritis, which is an age-related thing. There are other types of arthritis which can happen even in younger age groups. Usually these are known as inflammatory arthritis. That means because of an inflammation of the joint, the cartilage starts to wear away. Most common type of inflammatory arthritis is rheumatoid arthritis. It can happen at even young ages like 20 to 30. And the same changes of wearing away of the joint can happen at this young age as well. A person who has rheumatoid arthritis has to get a few tests done known as rheumatoid factor, which will determine whether they have this particular condition or not. Rheumatoid arthritis is slightly different from osteoarthritis, that it's not an age-related thing. It doesn't happen like due to normal wear and tear, but it happens due to inflammation of the joint. It happens at a younger age group, and usually it is associated with other joint pains. For example, a person with rheumatoid arthritis will have pain in all the finger joints with a lot of swelling, associated with the knee joint and the hip joint pain as well. And also the swellings are very important. They're usually more in the morning times and associated with a lot of stiffness. It will be very difficult for them to move those joints. Then you have to be suspicious of this rheumatoid arthritis. The treatment of rheumatoid arthritis involves 2 doctors. One is the rheumatologist and one is the orthopedic surgeon. The orthopedic surgeon will treat the joint, the knee joint, once it has worn away to a particular extent and where they may require a surgery. And the rheumatologist will treat the other swellings of the joints and the pain in the smaller joints. It usually involves medicines like steroids and something known as DMARDs, disease modifying anti-rheumatoid drugs. These are the 2 most common types of arthritis in people. How to treat early stages of osteoarthritis? Very simple. Don't ever think of surgery. Don't go to that stage. You don't need to go to that stage. You have to be very careful with some lifestyle modifications. Reduce the weight, because all the weight falls in the knee joints. Make sure you do some very specific knee exercises which strengthens the quadriceps muscle and offloads the knee joint. Avoid sitting on the floor, squatting or cross-legged. Even to have food or to do pujas or whatever prayers, you should avoid sitting on the floor, and try to minimize climbing up and down stairs. These are some lifestyle modifications which will help to reduce pain in arthritis, in early stages of arthritis. Thank you.
Sunshine, it's our sunshine.